Hello, and welcome to the Surgical Dashboard demonstration. The Surgical Dashboard application empowers operating room managers and directors to visualize data that illustrates primary concerns, patterns, and performances as it pertains to operating room management, efficiency, and utilization. Some key elements of the application include ensuring patient safety and the highest quality of care, providing surgeons with appropriate access to the operating room, maximizing the efficiency of the operating room utilization, staff, and materials to reduce cost, decreasing patient delays, and enhancing the satisfaction among patients, staff, and physicians. In this example, I will wear the hat of an administrator. I work for Rusher Medical Center, and I want to take a look at the scorecard to see if I can spot any trends. So let's get started by heading over to the Scorecard tab. Now that I'm on the Scorecard tab, the first thing I want to do is select the Rusher Medical Center. Next, I want to select the year 2013. So I'll go up to the year box and select it. After selecting 2013, I can see that the percentage of first case late starts is 12.7%, which is higher than our predetermined acceptable level. Let's take a look at 2012 to see what our percentage of first case late starts was for that year. To do that, I'll select 2012 from the list box. After selecting 2012, I can see that the first case late start percentage was 4.21%, which is well below the 12% that we saw for 2013. I need to gain some additional insight into these numbers. So what I'll do is select 2013 again from the year list box and head over to the operations tab to see if I can gain any more insight into why the percentage of first case late starts increased from 2012 to 2013. Now that I'm on the operations tab, I want to head down to the first case delays chart to see if I can gain any more insight into why our percentage of first case late starts has increased so much for 2013. Overall, for the Rusher Medical Center, I can see that there were 30 first case delays in 2013 so far. On the days when there was a first case delay, the average delay for the rest of the cases for that day was 28 minutes and 6 seconds. On the days when there were no first case delays, the delay dropped significantly down to 7 minutes and 49 seconds. That's a pretty interesting find. Now let's see if we can get some more details into our first case delays for 2013. To do that, we'll use the cycle button to change the dimension from location to procedure specialty. Once we switch to dimension, we can see that general surgery seems to be the culprit for the first case late starts with 30 first case late starts. So let's go ahead and select general from the procedure specialty and see if we can gain some more insight as to what's causing these delays. Once again, we'll use the cycle button to change our dimension. We'll move from procedure specialty to surgeon. Now that we're looking at the surgeons, we can see that Dr. Sauter and Dr. Rude are causing a lot of the delays with the first case. So let's go ahead and select those two from the table and take a look. We can see that both doctors have 4 first case delays, and when they have a first case delay, Dr. Sauter has an average delay for the rest of his cases that day of 34 minutes and 45 seconds. When he has no delay in the first case, he only goes over about 12 minutes and 15 seconds, which is a decrease of about 22 minutes. Dr. Rude, when he has a first case delay, the rest of his cases for that day run over about 30 minutes. When there is no delay in the first case, his cases only run over about 8 minutes and 40 seconds on average. As you can see, having our first cases start on time is critical for helping us to reduce cost and to increase customer satisfaction. We need to sit down with Dr. Rude and Dr. Sauter and help them understand the impact that a first case late start has on our entire operations. So in conclusion, our data discovery started out at a high level, which was Rusher Medical Center. We worked our way into a particular specialty, which was general surgery, and then we finally narrowed our data down to 2 surgeons within the general surgery specialty and identified that those 2 surgeons, Dr. Souter and Dr. Rude, were causing a majority of our first case delays, proving once again that ClickView simplifies analysis for everyone, everywhere. This concludes the demo.